Good morning, you're through to the NHS 111 service. My name's Milo. Are you calling for yourself or for someone else today?
Yeah, my name's Milo Foster. I'm an IUC health advisor over at 111 in Wakefield.
First name with the spelling.
My name's Nav. I'm a health advisor from Wakefield 111.
Good morning, you're through to NHS 111. My name's Lindsay. Are you calling about yourself today? So we work on a basis of ruling things out. So we have to rule out life-threatening conditions first. So some of the questions that we ask might not be relevant to what you're ringing about, but it's so that we can get you the right care and the appropriate service for what's going on.
We can send you to, like, for example, chemist. We can sometimes book you in an appointment at your GP. There's different walk-in centres, so it's not always in an emergency department.
I think that the saying, I think especially what people use, emergency 999, non-emergency, come through to ourselves at 111. But again, if you're not too sure, give us a call. I think when you give us a call, it does go through the little script of if you've got chest pains, heart attack, signs of a stroke, go to 999. Or you'd be surprised how many of those come through to ourselves. So yeah, I think if you're not too sure, come through to 111. We'll always be able to take you through an assessment and give you some help. So.
We're a great service. We can help people, and there's nothing more satisfying than when somebody rings and you actually manage to get them an appointment somewhere, and it makes you feel like you've tied up that loose end for that patient. But you can ring us anytime. I mean, some people do get misconceptions in that they think we can diagnose over the phone. We can't. We're an assessment and signposting service. So if you've got symptoms that need assessing, we can do that for you, and then we'll signpost you off to a service that's appropriate for what's going on.
So it takes a lot of pressure off other services, for example, emergency department, GP, things like that. We can triage you and signpost you to the right place.
I'm Linda, 82, and I live alone. I recently had to visit Scunthorpe Hospital emergency department twice after a stroke last September. The first time when my eye began bleeding, NHS 111 sent me to the hospital, and although it was busy, staff were expecting me. An eye clinic appointment the next morning confirmed it should heal naturally. A week later, severe pain returned, and again 111 notified the hospital ahead of my arrival. An ophthalmologist was available, and I received treatment and medication to take home. Across both visits and services, 111, the ED and the eye clinic, I felt safe, supported and well cared for, which meant a lot living on my own.
I was admitted to Scarborough Hospital as an emergency after feeling unwell and struggling to urinate. NHS 111 advised me to attend the urgent treatment centre within 4 hours. I arrived at 10 a.m. and within an hour I was moved to a ward, put on an antibiotic drip and diagnosed with sepsis. I spent 4 days in hospital receiving antibiotics. Throughout my stay, every member of staff was attentive and professional. The care was faultless, and I felt fully supported during what could have been a life-threatening situation.
I contacted 111 twice last winter due to my husband's worsening respiratory symptoms. While the initial questions asked helped, the callbacks I received repeated much of the same information, and I was advised to take my husband to hospital myself, without being asked whether I was physically able to do so. When I explained that I wasn't able to do so, I was told to expect a long wait for an ambulance. In the end, the paramedics arrived very quickly, and they were excellent. At the emergency department, my husband was seen promptly, but the 8-hour wait was uncomfortable for him, with little privacy or updates. Overall, the staff were very caring and professional, but better communication, attention to comfort would have improved the experience for his time in the emergency department.
My name is Marie, and I recently had to take my daughter, who has epilepsy, to the emergency department after she suddenly developed breathing difficulties while on antibiotics. During the NHS 111 call, her symptoms worsened and we were told to go straight to the hospital. When we arrived, she was quickly triaged and given adrenaline, which improved her condition. We later learned she had had an allergic reaction to penicillin. As a nurse, I know how pressured emergency care can be, and the clinical treatment was excellent, but the experience would have been less stressful if the receptionist team had been more approachable and communicative. Small gestures and updates can make a big difference to worried families.
I'm Ashley, 62. On the 22nd of January 2026, my life changed. After feeling unwell at work, I left and returned home when I developed arm pain and chest tightness. I called NHS 111. A first responder arrived quickly. He told me I was having a heart attack. Minutes later, I was taken by ambulance to Leeds General Infirmary, where a team was waiting and fitted 2 stents immediately. The next day I was transferred to York Hospital and discharged after 4 days. I've since returned to Leeds for further assessment and I now require a heart bypass. It was frightening, but the fast coordinated response from 111 to the responder to the paramedics and both hospitals undoubtedly saved my life.
You'll end up at ED if the answers to the questions deem that as the most appropriate service for you. We can never say when somebody comes on phone what that right service is going to be, because it is all dependent on the answers to your questions. Sometimes as we're asking the questions, we might ask you extra things to determine you're giving the right answers, but wherever you end up will be appropriate for the symptoms that you're displaying at the time of the call.
Obviously things that a doctor can do, doctor can't do. If you've broken your leg, we're not going to advise you to call your doctor. You know, there is things that typically it's going to be a long way, we understand, but again, it is urgent. We either need to get you seen in a hospital setting instead of more of a doctor setting. So yeah, if you do need to go to A&E, very important, very vital.